or national level, please know that we love to voice the concerns of our small businesses. And what really sets us apart from any other organization is our business development specialists that are here on site that can assist you in any phase of business, whether it's access to capital or helping you access new markets in your business. I just briefly wanted to share with you a little bit more about our three grant-funded centers, a part of our entrepreneurial technical assistance centers here operated through the El Paso Hispanic Chamber. The Women's Business Border Center is the program that I do manage, and it is a joint partnership between the El Paso Hispanic Chamber and the United States Small Business Administration. I'm really happy to announce that the Office of Women's Business Ownership through the SBA has expanded their Women Business Center network. They've added close to 25 more business centers. So there's a total of 136 throughout the United States that provides assistance to entrepreneurs. Our MBDA Business Center is funded through the Department of Commerce, and this is where we target and support growing minority businesses. Whether it's helping you scale your business, access procurement opportunities, or even access to capital, just know that we're here and available for you. I also wanted to share with our viewers that we do have our Minority Women's Enterprise Diversity Center off of Executive, where that was our official training center. And that's where we would conduct in-person events, trainings, and of course, we do have some spaces available for businesses if they do need it for office space. And so now, thank you for what we're here today. And it is my pleasure to introduce one of our board members, Andrea Tani, that will go ahead and introduce our special guest today. Thank you so much, Andrea, for being here with us today.
Thank you, Mary Helen. It's a pleasure and an honor to be part of the session today and to introduce Dr. Lang.
And I just wanted to share with our viewers today a little bit about your background. Andrea currently holds a PhD, and she's the Vice President at Texas Tech El Paso Office of Institutional Advancement. Before joining the Texas Tech family, she served as the New Mexico State University's Vice President of University Advancement, Marketing and Communications, and President of the NMSU Foundation. So we're so happy that we were able to recruit you to Texas and El Paso, Andrea. Within 5 years, her team raised more than $100 million in cash and pledges and set a record high of fundraising marks for 2 years in a row. And that was back in 2017 and 18. So that is so awesome. So she's a very key in fundraising, program development. Of course, she's worked in higher education for 16 years. And of course, prior to NMSU, she served as the Director of Development for the Schools of Nursing and Allied Sciences at Texas Tech in Lubbock. So with that, with no further ado, just thank you so much, Andrea, for being here. You're so very well accomplished and you're such an asset to our board. So take it over, Andrea. I'll turn it over to you.
All right, well, thank you for that introduction. It's a pleasure again, and just so honored to be part of the El Paso Hispanic Chamber. So today I have the honor of introducing my boss, President Lang, Dr. Lang, Rick Lang, many, many titles. And as I share some of his background, you'll see why it's so awesome that we have someone like Dr. Lang of his caliber and expertise to be able to share about vaccine education and answers questions from our board membership today. So Dr. Lang, he is our first inaugural president of our Health Science Center, El Paso. He joined us in 2014, and he likes to joke that he's the best president we've ever had because he's the only, but I know if you've met Dr. Lang and have worked with him, you know that there's no joke about it. He is the best, and he really has raised the level of our institution and all that we do for our community and raising the level of our mission. So it's a joy to work alongside him and everything he's accomplishing for our community. Before joining Texas Tech El Paso in 2014, he served as Vice Chairman of Medicine and Director of Educational Programs at UT Health Science Center in San Antonio. He earned his bachelor's in biochemistry from UNT and his medical degree from UT Southwestern Medical School in Dallas. His internship and residency training were at Johns Hopkins Hospital, and before he returned to UT Southwestern for his fellowship training in cardiology. So many of our community members actually know and receive wonderful care in the community from Dr. Lang as a cardiologist. But more than that, he's also a great mentor, teacher, has taught our students, continues to mentor and teach our students, and has also grown our institution now with the addition of the dental school. We have the nursing school, graduate school, biomedical sciences, as well as the medical school. And between our residents and students, almost 1,000 learners on our campus, and it continues to grow, and over 2,000 employees. So without further ado, I will introduce Dr. Lang and let him say a few words as we segue into vaccine education. And I'll start with some of the Q&A once Dr. Lang gets started. So welcome, Dr. Lang.
Great. Well, Andrea, back at you. As Mary Helen said, recruiting you here from New Mexico is probably the greatest feat I've had here during my short tenure. That's great. And I'm really pleased to be a part of what you all are doing this afternoon. The Hispanic Chamber does such wonderful work in our community and supported the university. So it's a real privilege to join you. Since the pandemic, the university has played a pivotal role in working with our partners and collaborating to make sure that from the very beginning, identifying what we knew about the virus and acquiring PPE and putting in safe practices, continuing our educational mission, continuing clinical care and, during this time, and then finally enrolling the vaccine here in the community. So I want to be a resource for you today to tell you everything that I know about that vaccine and to answer any questions you have. There are a lot of misperceptions out there, and I'd like to clear those up. I'd like to identify things that we don't know yet, but are examining. So this is a time, I know many of you submitted questions already. The chat is another opportunity to do that. So Andrea, I'm going to hand it back to you, and I'll let you moderate and address the questions, and I'll answer them. And if I don't answer them fully, nail me and say, no, tell us more.
Okay. Well, Dr. Lang, I just wanted to share with everyone listening and viewing today, the rollout of the vaccine. Of course, we've heard a lot of the challenges, and I just want to again tout the leadership at the Health Science Center and amongst our community and our partner hospitals. You know, oftentimes you'll get a couple of days notice, and we did. In fact, if you can just walk us through when you were notified and how our team and community quickly jumped into action over the holidays, the Christmas holidays, to administer over 2,000 vaccines on our main campus, and then another 1,000 vaccines, I believe, at our Trans Mountain Clinic and then our Kenworthy Clinic.
Right. So, Andrea, the vaccines really obtained FDA approval in the second and third weeks of December. And after that approval, they had to distribute those vaccines nationally to every state, and then every state had to deliver them to all the localities and decide the best way to do that. We knew on December 17th that the vaccine had been approved, the one that we were expecting to get, and we hoped to get it December 19th. It didn't come, it didn't come, it didn't come. And then we received word on December 23rd that it would be arriving. So no advance warning at all. And interestingly enough, I received a letter from the governor, all of us did, saying, what's taking you so long to administer it? Well, that's on Christmas Eve day. That wasn't going to happen. But that Monday, immediately after Christmas, we began administering the doses. And within 8 days after that, had distributed about 3,000 doses. And by the way, for those of you that are listening and are frustrated about how do you get the vaccine and why isn't there more coordination, unfortunately, that all of the centers that are receiving it have a very similar experience. You all are aware that UTEP planned to immunize their campus today, but the vaccine just didn't arrive yet. So we received very little notice. They wanted out very quickly. And I must say, when you look at all the metropolitan areas around Texas, El Paso's done better than every other large city in Texas. So per capita, we've actually received more vaccines in many of the larger cities, because the key to getting more is you have to get it out as quickly as possible. You know, from the people that are getting it, it's frustrating because you don't know where to register. Sometimes it's 3 or 4 sites. You have to wait in line. Oftentimes, and we can talk a little bit more about that. But I want to let you know that here at the university, I wish we had more vaccine now, but the first 3,000 doses we delivered, we were, the team was ready, and we had no waits to get the vaccine. People walked right in, literally got placed in the vaccination center, got the vaccine. We wait 15 minutes to observe them, and they were out the door. So from the time they walked in to the time they walked out, it was no more than 20 minutes for the 3,000 doses. Again, that's a lot of teamwork, a lot of volunteers. And Andre, you know, I was giving vaccines as well during that time. In fact, we'll start again Monday with our second dose, and I'll be cleared out my days to give a vaccine as well to make sure that we can meet the needs of the community.
Thank you, Dr. Lang. I think that's a good description. And I know because it has been so frustrating across the country and even in our own community with all the challenge to roll it out. And so hopefully that puts a little bit of perspective of just some of the logistical challenges as the recipient of a vaccine site. And as I heard yesterday, you know, there's major cities across Texas that are not doing mega sites. And so their vaccination process that's rolling it out to the greater community has been a little bit slower than even El Paso, despite the challenges we're seeing. Is that correct, Dr. Lang? And what have you heard about that?
No, you're absolutely right. So right now, the state's asking for places that can be mega sites, that is delivering somewhere between 1,000 to 2,000 vaccines a day. Early on, we, UMC, and the Department of Public Health was delivering between 500 and 1,000 on a daily basis. So that's enabled us to get additional vaccines, but the logistics of that, again, are very difficult. But again, we've done a much better job than most other major metropolitan areas.
Wonderful. That's wonderful to hear. I'll jump into some of the questions that I know Mary had already received prior to the webinar today. And the first one, we'll just kind of go, there's kind of a progression of the questions. So I try to categorize them, and you may answer some of these questions as we're going along on some of these that have already been submitted. So I'll jump in. What are the current COVID-19 vaccine recommendations for children and adults based on the clinical trials that have taken place so far?
Right. The clinical trials that have been done so far have been in individuals above the age of 16. And so our current recommendations related to vaccine administration really just covers that group. Now you say, well, that's really kind of unfortunate because we have a lot of kids going to school. Well, there are currently studies now where they're enrolling sites. We're asking actually to be one of those sites as well. So we can vaccinate the younger children, adolescents and younger children, to make sure that they have the same immune response. But right now, the recommendations only apply to giving vaccines, and I believe they've extended down to age 14 on up.
Okay, and so someone wrote in, should I take a test to see if I'm currently infected with COVID-19 before getting the vaccine? What are your recommendations if they're having symptoms or they think they should get tested before going to get the vaccine?
That's an excellent question. The current recommendations are not to be vaccinated if you're actively infected. So if someone has symptoms suggestive of COVID, or even a viral illness, because you want the vaccine to be effective, and it's going to be effective if you're giving to somebody that's not sick, because somebody that's sick is already making antibodies. And so you may not have an adequate response. So if a person is symptomatic, or if they've recently had the COVID infection, we're recommending that they not get the vaccine. Excuse me, my lights just went out. I've got to wave my arm a second. Motion activated. But do you need to have routine testing if you're not symptomatic? The answer is no. In fact, that will just delay vaccine, because many of the individuals on this seminar or webinar with us, they'll get a call and say, listen, we have vaccine this afternoon, come down and get it. And if you actually waited to get tested, first of all, it's not fruitful. Second of all, it would delay that. Andre, can I take a step back for just a second? Because Cindy Reynolds had asked a question. First of all, why get the vaccine? I mean, let's just take a step back and we'll talk about some of the specifics. Because people are saying, well, I'm concerned about the vaccine. It was developed so quickly. What we know about the COVID infection is clear. It is an infectious virus, much more infectious, for example, than flu. It caused hundreds of thousands of deaths, over 400,000 deaths here in the United States as well. And then people that recover oftentimes have long-lasting symptoms. And by the way, it's possible to get the COVID infection more than one time. We know that the vaccines, the two that we have now, are 95% effective in preventing symptomatic COVID infection. And for the rare individuals that did get COVID infection after the vaccine, it made it a much milder disease. So I don't want anybody on the phone call to be listening and saying, gosh, I wonder whether I should get it or not. The risk of getting COVID infection and having a severe event, especially if you have underlying conditions, is very high, much higher than one would ever have an issue with the vaccine. So definitely individuals should get it.
And Dr. Lang, I know you actually sit on one of the FDA panels, and I know there's a few different ones, but I'd love for you to just share your FDA panel, because I know that you're constantly reading, as many of our faculty, and that's the beauty of having a health science center and a faculty who both practice and are doing the research. And so I heard you say something yesterday that was interesting to me about the effectiveness of the COVID vaccine, because you said, again, 94, 95% effective. Our flu vaccines are not even that high. Can you talk to us a little bit, again, what you hear at the FDA and other vaccine effectiveness compared to this one? Right.
There are two things about the COVID vaccines that are just remarkable. One is how quickly we developed them. Now, that doesn't mean that they're any less safe. They've been tested in over 70, these two vaccines, we have over 70,000 individuals, half of whom received placebo, half have got the vaccine. So it underwent the very stringent safety and efficacy, effectiveness studies that the FDA demands. And the interesting thing about it is, because we're so good at technology now that we can make these vaccines quicker, and we tested them in tens of thousands of individuals very early. This is 95% effective after the second dose, 2 weeks after the second dose. Let's take a step back and say, if you have a flu vaccine and if it's 70% effective, you think you've hit a home run. Mm-hmm. Nobody ever expected a vaccine to be quite this effective. So not only the speed with which we got it to market, but also how effective it is really remarkable.
Thank you. That's wonderful to hear. And that also kind of leads into the next question. So is it going to be like the flu vaccine, where you're anticipating we may need to get it annually? And how many doses in this initial vaccine are taken?
Okay. The two vaccines that are approved in the United States are both called messenger RNA vaccines, or mRNA vaccines, and they require 2 doses. One of the vaccines, the Pfizer, requires a dose 3 weeks after the first dose. The Moderna vaccine, also an mRNA, requires it 4 weeks after. So everybody will get 2 doses with these particular vaccines. And people, by the way, always ask, well, when is it effective? Well, we know that in the first 2 weeks, there's really no significant amount of antibodies made. And those antibodies are what fight the viral infection. But we know 2 weeks after the first dose, it begins to become effective, but it's not fully effective till 2 weeks after the second dose. So that's when it's 95% effective.
Okay. Thank you. And speaking of that, I know, again, across the country, we hear quite a bit about side effects, and that's natural of sort of any vaccine we receive. So can you talk to us a little bit about the side effects of these particular vaccines, the Pfizer and the Moderna, and then maybe just how that compares, again, back to, the flu vaccine, because again, that gives some people something to compare to as people are considering this vaccine.
That's great. First of all, I'll talk about the most severe reaction. That is individuals that might get a vaccine and then develop shock, or what's called an anaphylactic reaction. The same type of reaction someone gets after a bee sting, for example, where their face begins to swell and they have difficulty breathing. That occurs extremely rarely. And that is, if I vaccinate 1 million people with these vaccines, only 11 individuals will have that kind of reaction. So it's incredibly rare. And by the way, the same thing happens after the flu vaccine, with about 1 out of every 1 million individuals. And by the way, it has the same thing after a bee sting and eating peanuts for young kids and those kinds of things. So it's extremely rare. And by the way, that always happens very quickly. So within the first 30 minutes. So that's why after we administer the vaccine, we watch everybody for 15 minutes But if anybody has a history of a severe allergic reaction, we ask them to wait for 30 minutes and we just observe them. And every site that administers the vaccine has the medicines to reverse that effect. So I'm not aware of any deaths that have occurred as a result of administration of the vaccine in the United States. Now, what's more common though is what I would call these minor reactions. Is that because the shot is meant to elicit an immune response, people have symptoms related to that. And about 3/4 of individuals will have either fatigue or headache. They may have some mild muscle aches or joint aches or fevers or chills, very rarely nausea or vomiting. Those are usually very mild symptoms. They always occur in the first 24 to 48 hours. They're usually easily treatable with something like Tylenol or aspirin. And they occur after the first dose and after the second dose. But again, they're mild. Oh, the other thing I failed to mention is everybody gets some tenderness in the shoulder, just like we do with all vaccines. And so that's to be expected.
Right. Okay. And along those lines, again, dispelling some myths and transparency about side effects. Tell us a little bit, are vaccine providers required to report these side effects, and talk to us a little bit about the transparency of that since it's been rolled out to the greater public now.
That's a great question. So the data we have, all the information I cited, was based upon studies that were done in 70,000 individuals. But now we're going to be giving the vaccine to millions across the United States. So everybody that is administered the vaccine should be given a sheet of paper that allows them to register with the CDC, and that allows them to report any symptoms they have over the next 5 days after they get the vaccine. Because if somebody goes home and has any type of allergic reaction or side effect, I wouldn't know about it because they're at home. But this allows us to collect information on millions of individuals that have received the vaccine. Now, if I, as a physician, see a side effect, if it happens that someone has one of the anaphylactic reactions, yes, we do report that. But the major individuals that are responsible for reporting are those that get the vaccine.
Right, that's good to hear. Okay, and then going into a question that I think Cindy asked us before the webinar got started. But we actually hear quite a bit, and I see it on social media, and I've heard, some friends kind of halfway joking about it, but I think it's a question that people are seriously asking, and that is, does the vaccine change my DNA? And I think there's a lot of, again, that scientific explanation to that I've heard you share that puts things in perspective, again, back to that transparency of the vaccine, if you can share that with us.
Well, the short answer is no, it doesn't. But if it did, I would try to get George Clooney's vaccine, okay? I'd love to look like George Clooney. No, the nice thing about this, what's called messenger RNA, is it doesn't in any way attach or interfere with our own DNA. I mean, what it does is it acts as a messenger for your body to make proteins that look just like the outside of the virus. They're not infectious. It's not the complete virus. It's just some of the proteins. And your body sees that to make antibodies. Now, what that means is when you actually do see the virus, you'll already have antibodies to it. And so that should stop the antibody from replicating in your body. And that's the whole virtue. So no, unfortunately, it can't change your DNA. In fact, it's completely impossible. In fact, when I give the injection, I tell people they're going to feel fevers or chills. And it's not that they've gotten the COVID infection, because it's impossible to get infected with the COVID virus from that vaccine, just as it's impossible for that to get into your DNA.
Okay. And one of the questions you talked a little bit about it, about the immunity to COVID after you've received the vaccine. But kind of back to the question of how long, or what are you hearing in terms of how long do you think that immunity will last over time? And will this be something that you anticipate we'll have to do on an annual basis, or what are studies showing on that so far?
Yeah. Well, one of the really nice things about the vaccine studies is that it shows that you make more antibodies getting the vaccine, than you do from the native infection. You take a step back and say, wow, I mean, that would imply that the vaccine may be more protective against a second infection than getting infected with the COVID virus itself.
Oh, wow.
Now, again, because these studies were done fairly recently, I know that once someone has received the vaccine, that we can detect a high level of antibodies at least 5 months later. Now, we're going to continue to follow these individuals for 9 months and 12 months, but right now the antibodies stay up. But that's just one piece of the puzzle, because that means you have active antibody, but when you give the vaccine, you've also you've targeted cells that know what the virus looks like, and when they see it, they can make additional antibodies. So you programmed your body already with that vaccine to make additional antibodies in the future, and also to have specific cells called T cells that can kill the virus. So we know that antibodies last a long time, but even after those go away, we still have the ability to mount an immune response to the virus. Now, Andrea, the $50 million question you just said is, how often will we have to get this? And I have to say, we don't know at this particular point. We know that, for example, with the flu, it changes regularly. We have to get a flu shot annually. The coronavirus has changed, but it doesn't change nearly as fast or as rapidly as the flu virus does. And the best estimate from the National Institutes of Health and the CDC is we may have to get it every 2 or 3 years, but the jury's still out on that right now.
Okay, that's good to hear. Okay. And I think one of the other questions that a lot of people have as well is in regard to just kind of the differences between the Moderna and Pfizer, because I think there's a lot of side-by-side comparisons, but it's always really nice to hear from a physician and someone who's had the vaccine, who's administered the vaccine, and can speak a little bit to the comparison of the two.
Great. We don't have any head-to-head comparisons to date of these two. I've gone very thoroughly through the FDA briefings. As you mentioned, I have the privilege of chairing one of the FDA panels, the one that approves circulatory and heart devices. And so I know how thoroughly they investigate and brief the panels and the public on these kinds of things. So I've looked at that data, and when you look at the effectiveness of those vaccines, both of them appear to be 95% effective. Then when you look at the number of severe reactions that occur, they look to be very similar as well. And then when you look at the minor reactions, interesting enough, they appear to be very similar as well. And the only difference to us as users is they both require 2 doses. It's just for the Pfizer, they're 3 weeks apart, and the Moderna, they're 4 weeks apart. That's really the major difference. Now, from my standpoint as a healthcare provider, the major difference is how you handle and store these vaccines. Because the Pfizer vaccine, they're the same mRNA technology, that is a messenger RNA technology in terms of the vaccine, but the Pfizer vaccine has to be stored in super cold conditions. We're talking about minus 80 degrees. Now, I grew up in Fairbanks, Alaska, and it gets about minus 40. It doesn't get to minus 80 in Fairbanks, Alaska. It's really cold. And then when you take it out of the freezer, it doesn't last very long. So the Pfizer vaccine can really only be distributed in centers that have access to those really cold storage facilities. The city has some, the UMC has some, we have a lot because of the research we do, UTEP does, but the general practitioner wouldn't be able to store those. Now the Moderna vaccine can be stored in a regular freezer or refrigerator, and that means it's going to be more widely available. So that's really the major difference. If you have the opportunity to get one of those vaccines, it really doesn't matter which one you get. Take the first one that is made available to you. Okay,
thank you. That's good. That's good to know that if you have the opportunity, it's important to get the one that you've been offered, that you have available. So that's good to know for the community. And then we have some specific questions from viewers that are related to different health conditions. So a couple of the questions that have come in are related to if you have pre-existing conditions such as MS. Someone wrote us in about MS and about Crohn's disease. So can you talk a little bit about any research out there with some of these pre-existing conditions and getting the vaccine?
Right. I'm going to advise, I assume that the individual that asked that question either knows of somebody with multiple sclerosis, MS, or may have some personal experience with it. And for this particular condition, I'm going to ask you to consult your physician or neurologist, because that condition, which is an immune condition, kind of waxes and wanes, and there are various ebbs and flows. So I would want to make sure that they've consulted with their personal physician to see whether they would recommend it or not. In general, for most people who have chronic conditions, it puts them at an increased risk of having severe infection and even death with the COVID virus. So we're recommending that they do get vaccinated. The person with Crohn's disease and even people with other immunocompromised conditions are recommended to get the vaccine. Now, again, because there's no active virus in the vaccine, it doesn't put those individuals at increased risk. They may or may not form as robust an antibody response, but the recommendations are that they still get it, especially if they're immunocompromised, because it puts them at risk of developing a severe COVID infection.
And also related to that, what about chronic disease? We see that, you know, is prevalent along our border in our community. So diabetes, obesity, heart disease. What are your recommendations on that?
Yeah, that's a really important question, because about 50% of the population has one or more of those conditions. And I'm going to repeat the ones you mentioned because they're all associated with severe infections. In other words, they don't make you more likely to get an infection, but if you do get it and you have one of those conditions, it's more likely to be severe. It's more likely to result in hospitalizations. And most of the deaths that we see occur in people with one or more of these conditions. You mentioned diabetes, chronic kidney disease, people that have underlying lung disease like emphysema, people that have heart disease like heart failure or coronary artery disease, people that have sickle cell anemia, and those that have cancer. Those are the high-risk individuals. And in fact, with the limited amount of vaccine now, we're trying to target those high-risk individuals, people over the age of 65 and people under the age of 65 with one or more of those conditions.
Great, thank you. That's great clarity to hear. And so another, not really a condition, but I think a lot of pregnant moms and people who are experiencing maybe trying to get pregnant or are pregnant, and kind of having to weigh these decisions. I know it weighs heavy on a mother's mind at this time. So can you share any effects of COVID vaccine on pregnancy, the developing fetus, or even in the infants?
Right. So those people were originally excluded from the studies, but because there were 2 doses, Andrea, there were people that got the first dose and then subsequently found out they were pregnant and then either got the second dose or got it afterwards. It's just a couple small handfuls. There's about 22 individuals in the 2 studies in which that happened, and none of them had any adverse reactions. It didn't affect the pregnancy at all. Obviously, we're waiting for the mothers to deliver, but the pregnancies are advancing fine going forward. We are concerned because the pregnancy seems to be a risk factor for having severe COVID infection. Even though there's not a great amount of data, we're not excluding women who are pregnant or thinking about getting pregnant from getting the vaccine. Again, it has no inactive or active virus in it at all. It just has a small piece of mRNA and is thought to be safe for the mother. But we have to advise women who are pregnant and are thinking about doing so is that our best estimate is that it's safe, but we don't have a large enough database to actually confirm that.
Thank you. And so let's say, you know, we keep hearing this term used throughout the pandemic of herd immunization. And I hear, as late as yesterday, we had some visitors talking about this and what's it going to take before our community, El Paso and the region, before we sort of reach this herd immunity, or we can feel like the majority of our population, enough of our population have been vaccinated. Can you talk a little bit about that term and what that means specific to El Paso?
Sure. I had herd immunity, H-E-R-D. You often think about cattle and moving together, but what it means is, Andrea, it would be great if I could vaccinate you, but it'd be even better if I could vaccinate you and everybody around you. That would be more protective. And then, by the way, everybody around them as well, and then around them. So the farther that I can extend that, the safer it makes it for you as an individual. And that's what herd immunity is. We want to vaccinate you and pretty much everybody that you might come in contact with, either intentionally or unintentionally. When we look at other viral illnesses, in general, we target immunizing somewhere between 60 and 80% of the individuals. And then at that point, we feel like we've protected most individuals, that individual and people around them, which makes us safe. So that's the target. Now, that immunity can come from people being exposed and having natural infection. Some of it comes from vaccine. But you bring up an important point, is that in our armamentarium, we not only have the vaccine to protect us, but all these other measures that we're doing. So, for example, let me ask you a question, Andrea. This may be TMI, or maybe personal health information, but do you know anybody in the last 4 months has had the flu?
No.
No. Well, interestingly enough, the measures that we've taken to prevent the COVID infection have reduced the flu infection rate by 98.5%.
Wow.
So in addition to the vaccine, to minimize the risk of transmission here in El Paso and across the US, we're going to need to continue the things that we're doing. We're going to need to continue wearing masks and socially distancing and washing our hands and not having large group gatherings until we can get the infection rate down near zero. So I want a lot of people that are listening to realize that this vaccine is not a get out of jail card. You know, go past go collect $200. You still have to do the things that we need to do to get the infection rate down to where it needs to be.
Excellent. That was actually a question that was sent in about post-vaccine precautions and how, just again, out of curiosity, how long do you see our community having to adhere to at least mask wearing?
Yep, I would be surprised if we're not doing it through the summer. There are a couple things. One is that even though the vaccine's pretty effective, 95%, it's not 100% effective, number one. Number two is we're not going to get everybody vaccinated across the city until the summer. I mean, if we did 50,000 a week, and that would be a noble goal, we're only getting 10 or 15,000 a week right now. But if we could do 50,000 a week, it would still take us 4 or 5 months to get everybody vaccinated. And then the last thing is we're absolutely certain that the vaccine prevents symptomatic infection. There's no question about that. What we don't know yet is it possible that you could get the virus, it really not infect you because of it, but you could transmit it to somebody else over a short period of time. So we have studies trying to determine that right now, but we don't know the answer to that. So for all those reasons, I think we're going to be wearing a mask for a little bit longer, except for when we have Zoom meetings like this.
Absolutely. That's good to hear. Just in terms of people understanding the expectations of trying to mitigate the risk and staying healthy the rest of 2021 as well. So that's helpful to know, which actually kind of segues into really what is focused. We have several questions focused on pediatrics. And now we have, several El Paso schools and students who returned this week. And so, Pete, we have some pediatricians who are curious, or if you've heard anything about when different pediatricians or practice settings will actually have access to the vaccine. We see again that, we have these mega sites in UMC and the local hospital and the city health department. So when do you anticipate maybe some of the providers and even maybe the pharmacies? We've heard about that as well.
Okay, so in terms of who we're vaccinating, we want to make sure we get all of the patient-facing healthcare providers vaccinated. And Andrea, as you know, when we got our 3,000 doses, we targeted our campus, but we targeted the community as well. Individuals, healthcare providers, nurses, medical assistants, even some front office staff that were facing patients, dentists in the area as well that didn't receive vaccine. So if there's a healthcare provider on this call that hasn't received vaccination, please let us know. And I'll put you in touch with the Department of Public Health or with UMC, because those individuals need to go to the top of the list. Now, with regard to whether pediatricians will get it to administer to children, I think that's going to be a ways off, because again, It's not recommended yet for children. We haven't done the studies to show that it's safe and effective yet. So I think that's going to be several months down the road.
Okay. And then have you heard anything? Right now, of course, we don't know. It's hard to even, as you mentioned at the beginning, for us to know when, each organization receives or is being notified about their vaccines. And so someone asked the question, how do I sign up to be a COVID-19 vaccine provider? But so let's take a step back and maybe talk a little bit about what the state level process is and how the state's receiving the vaccines, the allocations, and then how the state then is allocating out to the various cities across the state.
So as you alluded to, there's a national distribution that goes to the state. And then the state has to decide among all the requests it gets, who gets it. Some of that's determined by the population. Some of it's determined by how many healthcare providers there are. Sometimes it's divided upon or it's decided upon whether you have the facilities. For example, if you can't store the Pfizer vaccine, then you can't get it. So based upon all of that information, the state is allocating the vaccine. We really don't have much input into that. We can make our request. And again, we're reminding the state is we're getting it, we're distributing it real quickly, give us some more. But they have Dallas and Houston and San Antonio and Austin and Fort Worth and Denton and every other place requesting the same thing. So that unfortunately that's the rub of that makes it very difficult for us to notify individuals and to staff to adequately distribute it.
All right, well, I have a few questions that have come in since we kind of walked through our questions that were sent in ahead of time. One viewer asks why perhaps an individual who's received the vaccine may have worse side effects than what we're hearing is kind of the norm across most people getting it. Is there a reason at all that someone may get it, those side effects any worse than others?
That is a very interesting question. I'll provide some observational information or data. In rolling out our 3,000 vaccines and in helping UMC as well, we've had a handful of people in which the symptoms I mentioned, the fatigue, the headache, the muscle or joint aches, fevers or chills, weren't mild, they were a little bit more moderate. And when you dig underneath the hood a little bit, you realize that some of these individuals had recent COVID infection. I said recent within the last month.
Oh, okay.
So I suspect what's happening in those individuals, Andrea, is they've had an infection, their immune system's already revved up, and then when you give them the vaccine, for them it feels like the virus is coming again, and they have a more robust immune response. And those symptoms I mentioned, they're just a part of the immune response. And so don't be concerned about it. You want an immune response. You just don't want the headache and fevers or chills that go with it. So again, that's observational data. If people have had a COVID infection, should they get the vaccine? Well, they're probably protected with their innate immunity for 5 months. After that, they should certainly get the vaccine. But I'm usually recommending that they wait for at least a month or two after their active infection is over before they get it again, primarily so they don't have the moderate symptoms that I mentioned. Let me go back, Andre, you asked a question I didn't answer, and that is how do you become a provider? The Texas DSHS, Department of State Health Services, has a website that a person can register on. Now, a person is usually an entity, but there are very strict requirements about what needs to be done, and that is you have to assure that you have the proper facilities for storing the vaccine and recording the temperature. That information has to be available to turn over to the CDC. You have to register all the individuals and provide that information within 24 hours after you register them to a central vaccine site. And you have to adhere to all the CDC guidelines and recommendations. So there's a checklist. It's not really as easy as it sounds. Okay. And I would recommend people don't try this in their garage, okay? So, but it'll walk you through that process if someone feels like they want to do that.
Good, that's okay. That's a great resource. I'm sure Mary Helen could also send that out to the group or anybody interested as well. Well, Dr. Lang, this has been very, very informative and really eye-opening, even for myself. And you know, we all read about this so often, and you get bombarded, overloaded with information. Is there one place that you recommend where you sort of get your really good data from, or just, you know, good places that people can go to as a resource to get information, not just on where to get a vaccine, but as studies come available, and just a little bit more in-depth knowledge and putting these myths, dispelling these myths about the vaccine?
Every week I go to the NYT, the New York Times, called Coronavirus Vaccine Tracker. And that gives you the latest information about how many vaccines are being studied, kind of where they're at, what they do, by the way. And it's a really easy to read site, and it's updated on a daily basis. So NYT, just type in New York Times, Coronavirus Vaccine Tracker, and it'll provide that information. The other great site is obviously the CDC. They give really pertinent information at whatever level you're at, whether you're a consumer or a healthcare provider. If you're looking for different types of vaccine information, the CDC is a great site for that as well. And then I'd also encourage, Andrea, I know you don't want me to open this up, but we want to be a resource to the Hispanic Chamber of Commerce and to the community, especially for providing accurate information. So if they want to email or text you, or email or text me, or do this again, I'm happy to do it.
Wonderful. No, that's a great resource. And I echo, I think any organization, or if there's an employer, or just anybody has general questions, but if there's, you have a group that's wanting to hear from the experts and those on the front lines, I think that is a great opportunity. And that's why we have our Health Science Center here to serve our community. So again, you always make that offer, and I know that it's very genuine, and I know our community appreciates that. So please, Mary Helen, if anybody is interested on taking Dr. Lang up on that, he genuinely means it, and we're happy to do this again as well, or just pass his email to anyone who's interested. And actually, I'll put a plug in. We're actually, if you miss this, this goes out to, to any friends, relatives, anybody that may have missed it or has more questions and would like to participate in another digital conversation. We started a tech table talk with Dr. Lang as our moderator. And we had our first session actually right before the holidays in December. And we actually had 3 of our students, a medical student, nursing student, and they all have served on the front lines, and talked really about their experiences. And this was right before the vaccine was rolled out, and really talked about all the challenges and just coping, and how they've gotten through it, and how they've served our community. And it was just so enlightening to hear their perspective as future healthcare heroes. Our next one is actually going to be next week, again moderated by Dr. Lang, and open to the public to hear firsthand from those on our front lines who have received, who are some of the first to have received the vaccine in our community, such as Dr. Black, our Dean of our dental school, and Dr. Reddy. She is chair of our OB-GYN department. And then we also have our chair of pediatrics department as well. We thought that would be a good combination for all the questions related to pediatrics, pregnant mothers, our dental school, who's working directly, as Dr. Lang said, with our dentists locally, as well as our associate dean of the nursing school, Dr. Manny Santa Cruz, as well. So he'll be talking from a nursing perspective, but such a great group of panelists who have so much expertise to offer. So please tune in, and I'll pass that information to Mary Helen as well, if y'all are interested in that one, and sending anybody who wasn't able to participate on this one. But thank you, Dr. Lang. Thank you, Cindy and team, Mary Helen, and the entire team at the Hispanic Chamber. You all do such a wonderful job, and we're just so grateful to be part of this. Thank you, Dr. Lang.
Again, a shout out to the Hispanic Chamber of Commerce. You guys do wonderful things for the community and trying to keep our businesses open and vibrant during this time. We'll do what we can to help make them safe so you can get there. So thank you for all you do.
Thank you so much, Dr. Lang. Thank you for the support that you give to our community. And of course, Andrea, thank you for sharing all of your expertise. It was very informative. I know it was very essential to our businesses. So thank you again. We're looking forward to maybe doing another one, maybe in the future. And of course, anyone that reaches out to us will be happy to share the contact information and more information about that table talk. So that's really interesting. Thank you for creating those forums. It's really important. So with that, I also wanted to thank you, Andrea, for your service of serving at the United States Air Force, and happy Inauguration Day. So thank
Yes, thank you.
you.
Thank you.
Sure. All righty. You all have a blessed 2021.
You as well.
Thank you. Bye-bye.